Developmental disability health was set up in the early 1990s by a collaboration between the Department of Human Services and Monash University and the University of Melbourne. The centre was set up to address the health needs of adults with developmental disabilities in our community. For children with disabilities, there are a plethora of services, and the complexity of their health needs is recognised and has been addressed by the multidisciplinary approach that's available to children. But for adults, the same services are not available, and the healthcare of adults, in particular the medical care, falls to GPs who've had little training or experience in working with people with disabilities. And so our centre was set up to resource the mainstream health system, to provide education and training for health professionals, particularly doctors and medical students, and also to provide an opportunity to do research into ways of improving the healthcare of adults with disabilities. And we also offer a small clinical service which forms the foundation of our teaching and our research. I'm really excited about the opportunities that our centre is going to be able to play in an NDIS world. At the moment, the complex health and social needs of adults with disabilities are provided for by health professionals who have little training or understanding of disability, and disability support workers who have little training in health. And unfortunately, the healthcare falls in the abyss between those two systems. Our centre is able to provide a bridge between those two centres and provide education and training and research around ways of better working together, helping health professionals better understand the needs of people with disabilities, and particularly developmental disabilities like intellectual disability, and to help disability support workers to better understand health needs of people with disabilities and their role, their vital role in the healthcare team. I want to raise the importance of health and function as one of the goals that people have. Perhaps it's not such a goal that comes immediately to mind for many people with intellectual disabilities, but it's the foundation of our lives. Our health is so important to us because if we have optimal health, then we're able to reach out and take advantage of the opportunities that are offered to us. If we're unwell or we're in pain, then we tend to turn inwards, and we're less interested in and less able to participate in the opportunities that are available to us. So maintaining health and function is a really important goal for people to have under the NDIS, and I see some of the funding targeted at things like perhaps people who may need to exercise regularly may join the gym, have a personal trainer. Some of those things might come under their goals for maintaining health and function. At the other side, it's very important to remember that the NDIS isn't going to provide everything for people with a disability. It's a complementary system to provide for people with the most severe levels of disability, but we still need our mainstream services, our universal services, to provide for all Australians. So another role for our centre is going to be to help the mainstream health service providers better understand the needs of people with disabilities and provide the education and training for their staff to better communicate with, better understand, better acknowledge and address the multiplicity of needs that people often have. At this stage of the development of the NDIS, it's still an evolving scheme. Somebody has said to me that it's like building a big infrastructure project like the Snowy Mountains Dam, and that took a long time. It took years before it was complete, and this scheme will take years before it's complete too. One of the things that's hard for participants sometimes, particularly if they've been in a day program, a standard day program, 9 to 3, it's hard to unpick what's really important in people's lives. What are the things that they most enjoy? What are the things that are important to them and the things that are important for them? And Health and function is obviously one of those that I think is very important. So people need to spend some time learning about each individual person and think very carefully about what are the things that give them pleasure in life, what are the things that give them peace and contentment in life, and how can we maximise those opportunities in people's daily life. And I guess the other thing that we need to think about all the time is working with Tier 2, so the mainstream system, to make sure that people's general needs for health, transport, education, justice, all the other universal services are also stepping up to the mark and providing for people with disabilities as well. The NDIS will bring a paradigm shift for service providers. We have in the past seen government block fund service providers to do whatever they essentially thought was reasonable to do for their clients. And people traditionally had a menu of programs from which they could choose. And some service providers offered a large menu and some offered a very small menu. Some took a great deal of care in providing the opportunities for people to choose and the support that people needed to choose. Others didn't, and it was really largely a convenience for the service provider of having people in equally sized groups for the various programs that were running. Even in Victoria, as we've shifted to individualised funding, much of that culture has remained, with people being at the service from 9 to 3 and being able to choose from a range of opportunities that the service provider has available to them. The NDIS turns all of that on its head. It starts with the person. The service providers are just that. They are offering a service from which consumers can choose. And people will start with the person and think, what is it that's important to this person and what's important for this person, and wrap around a series of supports and life opportunities for that person that will best meet their needs. Now, in the short term, the shift is going to be, it is a paradigm shift, but there are constraints with the current funding. There are constraints with the way accommodation services are funded, for instance, so that people who are living in supported accommodation, there isn't always a staff available during the day, so that day services have traditionally taken responsibility for people during the day. So there are quite a number of systemic shifts that are going to have to occur over the years, but they will occur because consumers will increasingly feel empowered to ask the questions, empowered to say, well, actually, I don't like that anymore. Actually, I'm not interested in doing that. Actually, I don't want to start at 9 o'clock. I'm a night person. I'd like to start I'd like to sleep in till midday, and then I'd like to be out and about until 10 o'clock at night. So this is just not something that people have had an opportunity to ever do before. And it's very exciting to know that just over the hill there's going to be a whole lot of creative solutions found and innovations available to people that are going to create opportunities that we don't even imagine now. So I'm very, very excited about the future.